I am Professor Dr. Vivek Gupta, Senior Consultant and Interventional Cardiologist from Delhi Apollo Hospital. On 2nd of April, talking about the corona pandemic and giving small messages to everybody, to the healthcare workers and to the public as such. We know, as this time we are passing through a very critical phase. The whole world is suffering from a pandemic by the name of COVID-19. COVID-19 is a type of a coronavirus which was initially came as MERS and SARS earlier, but this COVID-19 which came from the Wuhan, the first case was reported in December in Wuhan, and later on spread to other European countries, and now India is also suffering. This disease is very deadly in the case because of high mortality which is seen, and also because it has a very high level of infectivity. That means it can infect people very quickly. As of today, India has more than 20,000 patients, 2,000 patients, and about 50 deaths all over India. The first case in India was reported on 30th January, but during the last 3 to 4 days, there has been an exponential rise, about 200 to 300 patients per day. The whole world is suffering. As today WHO figure is that 9,54,000 patients are almost suffering and there have been more than 48,000 deaths. This is really alarming. As a patient or as a public, what we can do to prevent? As you know, the Government of India and Honorable Prime Minister Mr. Narendra Modi ji has started lockdown, and today is the 8th day of lockdown. Lockdown means that everybody is requested to stay home. All over India. It's not easy, I know, but it's important. Why it is so important that you should stay at home? Because this virus normally has a very high level of infectivity. If you go out and there are people who are sitting with you, if anybody who is having mild fever, he may be a patient of actually mild to severe fever, he may be a patient of coronavirus, and he has a possibility of infecting you. And therefore you have to stay home. Today 202 countries out of 205 has been infected by coronavirus. When it's going to finish off, we don't know. Almost 50% of the world population is under lockdown. Everybody is requested that they should stay home. Then what else? This is known as social distancing. That means if you're not going out, you're distancing yourself from the other social people. What else we should do? We should do a hand hygiene very frequently. Sanitizers have to be used. You have to keep cleaning your places of work, especially the hard surfaces. Why hard surfaces have to be cleaned regularly? Because the virus stays on the hard surface for more than 2 to 4 days. If somebody comes there, if you go to the shop for essentials, to buy medicine, to buy for the milk, or sabji, or vegetables, and you touch the hard surface there, you never know, somebody might have infected. For the healthcare worker, it is very, very important. What do we mean by healthcare workers? Healthcare workers are doctors, nurses, attendants of the patients at the moment, and also the ward boys, housekeeping boys, staff working in the laboratories, all these are healthcare workers. So everybody who is a healthcare worker is requested to use the mask all the time. I'm sitting in my chamber, so I have a small liberty to remove the mask for some time. What to do when you go out? As such, there is no guideline from the government. But I personally feel as a doctor that if you go out for essentials, please cover your nose and the mouth with the help of either mask or your hanky. Because there are some reports which are not confirmed that virus can also stay in air for some time. If you're crossing the place of the vegetable shop, and if the patient, some other patient or corona has gone through, and if he has sneezed out or coughed, the virus staying there for some time and you don't know whether you're infected or not. This is not sure. We don't know, as such the science does not say. But we will see that it is important that we should cover the nose and mouth all the time. What to do the patients who are diabetic? There are reports that those patients who are diabetic and whose blood sugars are not well controlled, they have higher chances of getting high severe corona. That means, as you know, if we see the whole statistics of COVID-19, out of 100 patients who are affected, 80 will be having mild disease. 20 will have or moderate to severe disease, and 10 will have severe disease. What do we mean by severe disease? Severe disease means those patients who have not only fever and cough, but they also have a breathing difficulty. As you can see from this, the main symptoms of COVID-19 is fever, difficulty in breathing and cough. The mild patients are those who are having only cough and fever, and they subside within few days or within 1 or 2 weeks time. There are patients from the mild, they become severe. Severe means that they will require oxygen, they have breathing difficulty, they will require hospitalization. It has been seen that those patients who have a poor immunity, because of any reason, anybody who is more than 60 or 70 years of age, anybody who has diabetes which is not well controlled, any patient who is having heart disease or cancer disease or treated by chemotherapy, these patients are having more chances of converting from a mild to severe form. And severe forms are those which require oxygen and sometimes ventilation, artificial ventilation. You must have seen from the reports on television that there is a shortage of ventilators in Spain and Italy. All the ventilators are exhausted because most of the patients are elderly there, and they are converted from mild disease to severe disease very quickly, and they require oxygen, non-invasive ventilation or artificial intubation. There are reports that they have to choose sometime between two patients. If they have only one ventilator and two patients are requiring it, they have to choose between, the doctor has to choose which one to give. It's a very bad situation. So therefore, if you are diabetic, you have to control your blood sugar better than what you were doing earlier. Because if you catch infection, then diabetics who are not controlled with blood sugar, with a good control of the blood sugar, they have more chances of getting into severe form, which we don't want to have it. Similarly, heart patients who have recent angioplasty, recent bypass surgery, what they should do? They are already taking medicines, but they have to increase their immunity levels. The best thing to increase your immunity level is by taking vitamin C and also take vitamin D. Vitamin C is also available in many fruits, many natural products like lemon, orange, musambi. Take it take extra morning, evening lemon. Vitamin C can be taken in tablet form also, 2 tablets thrice a day. Similarly, you can also do a little exercise at home to increase your immunity. Do breathing exercises. When you are breathing exercise, you are increasing your lung volume. If you do regularly morning, evening and afternoon, then your lung capacity goes up. In case you catch infection, then the chances that the lungs will be, even with a good lung volume, if you have a good expansion, the chances that pneumonia, your requirement for oxygen will go down. And therefore you have to take care. So lastly, I would like to tell that all the patients who have traveled from outside, all the people who have traveled from outside, if they have fever, they have to take more care. So I have discussed, just to summarize, hand hygiene, very important. All the time you have to clean your hands. Not all the time, at least thrice a day if you are home. When you go back home, all the healthcare workers, or you have gone out for some reason to buy vegetable, to buy milk, and you will come back home, try to clean your hands completely. Try to remove the hard surfaces, for example, key of the car. You have to sanitize it and then keep it safely. And then, of course, ask for everybody in the home to keep cleaning the hard surfaces at least thrice a day, 3 times a day. All the hard surfaces at home should be cleaned, because there are many families where there are maids still coming. Outside workers are coming, drivers are coming. Let all the people who are coming from outside, they should wear the mask at home. That's very important. You may not wear the mask at home, but the people who are coming from outside to work in your home, they should keep wearing the mask at home while they're working. So there are a few things which you have to take care. We hope that this COVID-19 pandemic will go off soon, but we don't know when. As I told you again, to repeat, about 10 lakh patients suffering all over the world, 50,000 deaths. America is the most important sufferer. India is still, we are still happy that we don't have many patients. We have, but still, to 2,000 patients by now. You have to be very, very careful. Honorable Prime Minister is very nice that he's taking active steps to control the pandemic, control the epidemic of the country. I hope that we'll take care of these things, and I pray to God Almighty to please save us from this epidemic, and therefore we don't want to become Italy or France or Spain. They are the worst sufferer. America, now number one. Starting from China, America is the number one sufferer. Thank you very much for watching this video. Please take care, stay healthy, and take all the routine precautions, as well as diabetic patients and the heart patients and cancer patients. They should take special precaution, and all the elderly. This is very important. Your parents should be having very important point I would like to tell you now. All the people who are more than 70, they should regularly take vitamin C and lemons. They should take, but of course, don't take extra. If you are a kidney patient, you are not allowed to take too much of potassium, because potassium comes from the lemon. So, of course, those patients who are specific patients like kidney patients, they have to be a little more careful because they cannot take too much of lemons. So be careful, continue to take your advice from the family physician and do the best whatever you can do. It has been seen that those people who are more than 80 or more than 75, if they catch infection, they have to be very careful. If they catch infection, they have a higher chances of going to severe form with breathing difficulty. And when they have breathing difficulty, you have to hospitalize them, quarantine them. It's a very difficult situation. So be careful, do the best, and help the government, and help yourself, help your family, help your friends. All the healthcare workers should also take hydroxychloroquine, as I've told in my earlier life. All the healthcare workers should take hydroxychloroquine as prevention. Hydroxychloroquine does not prevent you from the virus. It will prevent you from a mild disease to a severe form. If you catch infection, it will remain mild because it reduces the virus load. The only thing to prevent is to sanitize yourself, keep sanitizing, cleaning your surfaces, hand hygiene, social distancing. Thank you very much, Dr. Vivek.